a school staff, we're seeing students at a very young age, as early as elementary school, that are starting to exhibit behaviors of mental illness that are concerning to us.
So just think 20%. You know, you're looking out in your classroom, for example, and you go, wow, several of my kids are really struggling right now. So it is absolutely true with the statistics, just baseline, that we know that kids are needing support.
When you think about the challenges that students are facing right now, it's, you know, depression, anxiety, ADHD, but it's a gamut.
Focusing on mental health for children is important. From the little ones all the way up through adolescence, it's a really big deal.
It's been frustrating and confusing. What do? You work with families, you work with your resources you have, and it's been pretty limited at this point.
We need support. We have got to break down the school walls and invite people who care about kids and who have the skills right into our buildings.
Back in 2011, I had experienced divorce, and I had 3 young sons, and my oldest son had struggled with some mental health issues growing up, emotional issues and so forth. And then when the divorce happened, there was a lot of devastation that he was feeling. But having somebody right there for him, available to him at any time during the school day, was monumental. And the key to that was that it was always anonymous.
One of the biggest pieces is probably building relationships with the students. We have the LSS staff on site in schools, which is very beneficial at all of our school sites right now. You know, it's kind of great. It's collaboration. We have staff that come in, they meet with administrators, counselors, social workers, they talk about students. Usually we're kind of on the front lines identifying students that we think have needs, and we're bringing them forward to LSS staff to go about their business helping our students find success.
It's an excruciating feeling when you are dealing with your own emotions and trying to be a strong parent amongst all that is going on. So it is almost a bit of a safety net. I shudder to think where he might be if I didn't have access to those resources and those services. Knowing how far we've come and how far he in particular has come with his life and his own emotional understanding and own introspection. But you know, this is a happy ending. This was a happy ending for us, by far. By far.
I'd encourage anybody to engage in a program like this, because what do you have to lose when you're working with a student that's not coming to school, might be behaviorally aggressive, might be verbally aggressive, is struggling with addiction, does not have the support at home? Why would you not bring in someone else to kind of wrap around that student and build support so they can be successful?
All of us have a stake in the game on children's well-being. Yes, there's urgency. Yes, it's working. We have shortages, but if we work together to get the services to the kids and bring the families with us, it's magic.